الناس كانوا مستنين. بس أنا ما أدري متى نبدأ نحن.
Do you want me to send him, دكتورة؟
دقيقة، أظن هم الآن ممكن يسمعونا.
Okay, دكتورة, you can start. We can start. Dr. Abdullah says we can start now.
طيب. Good evening, everyone. Can everyone hear me? If you want to answer, you can say no, or you can say yes or no, and so that we can respond. It's my pleasure tonight to introduce Dr. Zainab Al-Khudairi. Dr. Zainab is a certified orthoptist at King Fahd University Hospital in Al Khobar. She earned her degree from Sydney, Australia in 2013. Dr. Zainab is the first Saudi certified dyslexia therapist in the kingdom. She has been working within this field for the past 14 years, and she has earned a lot of experience with her hard work, and she's also part of the International and Kuwait Dyslexia Association. She organized over 12 awareness campaigns, and also she's involved in the teaching team at King Fahd University Hospital in Dammam. She has been an examiner for the Saudi board for the past few years. Her topic today is very interesting, and it's really constitutes a dilemma to us as an ophthalmologist, pediatric ophthalmologist especially, as it's a real rare disease. She will be talking to us about learning disability, or what's called dyslexia. She'll be talking to us about the definition. She'll give us an overview of the signs and symptoms, the prevalence, and different research studies which has been going on in this topic. She will be introducing to us the difference between Irlen syndrome and dyslexia, the different interventions which are available in this field, and what's the role of the optometrist, what's the role of the ophthalmologist in this disease. If you have questions, please post it to the in the question and answer section, and we will entertain this at the end of the webinar. The last 10 or 15 minutes will be for questions and answers. And if you want to be talking, you can raise your hand and we will see if we can let you talk. It's my pleasure to introduce Dr. Zainab Al-Khudairi. Please share the screen with us, and go ahead, Dr. Zainab. Welcome.
Thank you, Dr. Amal, and thank you, Dr. Mohammed Shamrani, for inviting me to this webinar. It's my pleasure. Assalamu alaikum. Good evening, ladies and gentlemen. I will talk today about dyslexia, as Dr. Amal introduced me, and I will start my lecture or my talk with a case study. So going back to 2006, I had a 15-year-old Saudi boy coming to my clinic, very upset, very depressed, very down, that he decided one day to leave school. He was in 10th grade, starting beginning of 10th grade. And he just said that I need to quit school. So when I sat with him and his mother and we talked a little bit, he gave me some symptoms that he felt, which he didn't know why. He didn't know what's going on. So he just, opened his heart and talked to me. So he had headaches when reading, unable to read properly. He sees the book fuzzy, and his mother didn't understand what that meant. He did a lot of spelling mistakes, although he was 15 years old. He cannot see letters or numbers very clearly. He felt that the books are too bright for him, especially his mother was forcing him to read newspapers, and it was very difficult for him. He used to write letters without dots when he was younger, and sometimes upside down numbers. He reads a word, he reads some words correctly, and then further down the page he starts to rub his eyes, and his eyes gets tired and tearing and everything, and he reads the words wrong. He is healthy. He doesn't have any illnesses. His family history: he has a sister who has color deficiency and a learning disability, and he has 2 nephews who might have a learning disability as well. He did a psychology test done by a psychiatrist, which was normal, and his IQ test was above average. On examination, an optometry examination, we did visual acuity without glasses. It was 20/20. Refraction, as you can see, a little bit of stigmatism in the left eye. Color vision was normal. Convergence and accommodation test was normal. Stereo acuity using Titmus fly, normal. I did a dominant eye and a hand test, which was his right eye. It was dominant in his right hand, and I'll tell you why I did that. And then there's a test that I did, which was a specific dyslexic test called Wilkens reading test, and I'll talk about it in details later. And he failed to read. So basically, after I did all these tests, I gave him the newspaper, and he sat on the examination chair, and I sat next to him, and I asked him to read. So I'll tell you exactly how he looked like. He was shivering, sweating. His hands were trimming, and he was about to really, really cry. And he could not read even one line in the newspaper. So he was very, very upset. So I thought, okay, what was the problem? Is he malingering? Does he have any psychological problem? Back then, I studied dyslexia, but I didn't really have patients. So he was my first patient. So it was just a puzzle for me. And I said, okay, so let me try to say maybe this patient has dyslexia and go on with the further examinations and further tests and further treatment and see what will happen. So I said, okay, this patient is not malingering, he has dyslexia. Dyslexia is a learning difficulty that is commonly viewed as an impairment in the processing of reading and writing, resulting in a reading ability that is significantly below the person's intellectual level. So what does this mean? The patient is, or the person is, let's say 15-year-old, but he can read like a 10-year-old or a 6-year-old, okay? This is what they mean in the study. Is evident when accurate and fluent word reading and or spelling develops very incompletely or with great difficulty. And these individuals apparently are very, very smart. They have a very or different interests. For example, painting, drawing. They like to read or listen to literature. They play music very differently. So they are very, very unique children or unique people. Types of dyslexia: we have visual. So the main 3 are visual, auditory, and phonological. And of course, I specialized in visual dyslexia mainly. And the person with dyslexia will have problems with the memory and processing speed when reading. Prevalence worldwide. So there was a study between 1994 and 1996 by Daring, and as you can see that the prevalence was very high in America, which was from 41% to 47%. Of course, there are a lot of studies. I just put some of them. And then there was another study which started in the US in 2000, and it was only 2.4% in one of the states, and then it increased to 5% after 5 years. And another study also, 2 different times. in, let's say, the end of the 90s, it was 1.3% in one or some universities in the UK, and then by 2002, it increased 2%. And again, there was a study in 2011 who categorized the prevalence of dyslexia depending on the orthographic system, the type and degree of dyslexia, and the reading age assessed, and also sampling methods used. So basically, when we start testing for dyslexia, we have to make sure that the child knows how to read. So I will not do a dyslexic child on a 5-year-old or a 6-year-old, okay? He has to really know how to read the words and understand. So a first grader usually is not really, maybe there are signs, maybe there are symptoms and everything, but I cannot say he has dyslexia unless he is 8 years old. And there was one study, I couldn't really find it, I only read it once a long time ago, was saying that when you start diagnosing this dyslexia is at the age of 9. And it was a UK study. But here in Saudi Arabia, it is usually he has to finish first grade, going to second grade. So that's about 7 to 8 years old. At least we know, and we make sure that the child can read. Studies among Arabs, there was a study in 2005 talking about the difference between dyslexia in children who speak both languages, Arabic and English. And now I need to stop at this point because a lot of parents come to me who studied, let's say, in the US, and they had children, and the children were like 6 and 7 years old. They studied these 7 years in English, and they came back to an Arabic school studying in Arabic. And they come to me and say, oh, my child is dyslexic. No, he's not dyslexic. It's a different language. He never studied Arabic. Arabic is a very difficult language, much difficult than English. A lot of letters that look the same, sound the same, as we all know, so they are not dyslexic. So there is the most important thing when diagnosing, and this is an important point, when we diagnose dyslexia, first of all, the age. Number 2 is which language is he using? What is his mother tongue? If he's studying in an English school and he's studying English and there is dyslexia in the English, that means he is dyslexic. If it's both, then he is dyslexic. If it's only one language, so make sure what is his mother tongue, as they can say, as we say. There's a study by the Kuwaiti Dyslexic Association in 2002, which showed a 10% among Kuwaiti nationals. Kuwait is a very small country, so there was like 3,500 students who had dyslexia. And then there was a later study in 2006, and as you can see, the prevalence increased 20% among Kuwaiti population. There was also a study in 2012 among in Sharjah in the UAE among university students who found 18% of them they are dyslexic. And then there was a study in 2012 by an optometrist in Riyadh who did a random test for 450 female medical students in King Saud University, and they were 2% dyslexic. And I should do a study because it's been a long time, but inshallah, hopefully soon. Because I can really say that more than 15% of people or children in Eastern Province have dyslexia. Okay, so what are the risk factors? The first risk factor is family history of dyslexia, and I'm going to show and share with you a family who 4 of them, they are dyslexic. They were thankful. I mean, I'm very thankful for them. I took the permission to share their pictures and to share their stories, and you can ask me any questions about them. If there's any, the second risk factor is premature birth or low birth weight, exposure during pregnancy, which is also an important point, to drugs, nicotine, alcohol, any medication that alters the brain development in the fetus. Binocular anomalies, there are a lot of studies talking about binocular anomalies and dyslexia, and we're going to talk about it. Environmental factors, illiterate parents, divorced parents, bad home environments can also cause dyslexia. And of course, ADD and ADHD. Now, if the child is diagnosed with ADD and ADHD, the child will have dyslexia, definitely. not because it's not because they didn't learn properly, it's because they have this condition and they needed to be treated. And I always refer them to a psychiatrist or a psychologist. They are the one who diagnose, they are the one who are responsible. Sometimes I see that the child might have ADHD, and I tell the parent, okay, this child is not sitting down in my clinic, does he have ADHD? She goes, yeah, he is, but I don't want to give him medication. So I tell her, this child has dyslexia. If he's not, he will have dyslexia. He will not learn properly. He will not concentrate in school. He will not sit in an exam for 2 hours in a chair and do the exam. So he needs to be treated for ADD and ADHD first before I even diagnose or treat for dyslexia. Dr. Amal, am I going too fast, or it's okay?
It's okay, Doctora.
Great. Okay. Binocular factors affecting reading efficiency. So in our ophthalmology clinic, in our optometry clinic, in our orthoptic clinic, we test the patient for amblyopia, suppression, of course, convergence insufficiency, and eye tracking. Patient with nystagmus can have reading problems or slow reading efficiency. High ACA ratio, low vision patients, anisometropia, and exophoria at near. Now, this doesn't mean that these conditions can cause, or people with, or children with these conditions can have dyslexia, but it could be one of the factors, especially convergence insufficiency and eye tracking problem. And I'll talk to you about a case who just came to me on Thursday. And he is a family friend who we did not know that he had a problem, and he did not tell his parents why he was failing university for 2 years. And it was just a very simple diagnosis, and I'm going to talk to him about him later. And there's a study talking about binocular vision and learning, binocular vision problems and learning, which was in the University of Waterloo in Ontario. And as you can see here, the number of vision problems discovered in this population were like 60% of students were labeled learning disabled, and 67% had binocular dysfunction at near. So it's either accommodative problem, eye tracking problem, convergence insufficiency, and all of them. Okay, so as you can see, this imaging showing a dyslexic brain and a normal brain. And it is said that a dyslexic brain works 5% harder than a normal brain. So basically, an easy definition, it is a neurological disorder due to a magnocellular system abnormality. So our magnocellular pathway transmits information from our brain to the eye, and basically the eye sees, and then the words are translated in our brain. So when there's a problem with this magnocellular system and it is slower than normal, this means it is a dyslexic condition. People with dyslexia will have also a larger right hemisphere in their brains than others. And there are some cells which are disorganized in their brains. And they are not neatly ordered like a normal brain, okay, or cells in the brain. As we all know that we have the left and the right hemispheres, we use our left side for reading, math, any logistics, and word analysis, sequencing, any language that we learn, we use our left side of the brain. So I always explain this to children, and I say that you are special. You are using the opposite side of your brain to read. And this is a very, very gift from God. So you are very special. I always tell the children, you are special, you are unique, you are smart. And I give them examples of Einstein, of other people who are dyslexic and they are very successful. Okay, so as you can see in this picture, it's showing the eye tracking. So this is a machine called an eye tracker for when we read. So they just basically hook some, it's like an ERG kind of, but it's like in the head and in the eyes. So what we do, in the eyes. So basically what they do is it's a tracker, it tracks our eyes when we read. So as you can see, this is normal because we have when we read, we use 3 oculomotor skills. First of all, fixation, we are fixing on the word, and then we have the saccades, and then we have the pursuits. The saccade and pursuits, we track the word when we read. So as you can see, this one, it reads how this person is reading, and it is very organized and very clear. If the patient had any problems with the tracking, so here the big circle tracks one eye and the small circle tracks the other eye. And then if this patient, sorry, I didn't put the other picture where it shows bad reading, but basically you'll see like a zigzag and everything is, you know, messed up, showing that the eyes are not working as a team and the eyes are not focusing, each eye is focusing on a different word. So he has a poor eye tracking. Okay, so basically when the person reads, or a dyslexic person reads, as I said, the information goes to the right side of the brain. He uses the right side of the brain. Problems with eye tracking. I can see the word, I can read it sometimes, but I cannot analyze it. And sometimes the child cannot read at all, or the person cannot read at all and cannot understand even 5 words together or a sentence together. So when I say, okay, read this sentence, he tries to read it. What did it say? I don't know. This is the answer. Okay. So basically, when we read, this is just a small example. When we read, light strikes the photoreceptors in the retina. Information is processed in the midbrain by the magno and parvocellular pathways. Information then moves to the visual cortex for further processing. Person with dyslexia, everything is messed up. The information goes to another part of the brain or the opposite part of the brain, and the process is very slow. Now, this is when the patient has a phonological dyslexia. What about when the patient has visual dyslexia? What happens? Okay, signs. Now, a mother comes to me and says, okay, my child is 5. He just started to go to school. Some of them, they don't even go to school till they are 6 or 7 years old. And I noticed that he talked very late at the age of 4 or 5. He has difficulty learning new words, problems with naming letters and numbers, difficulty learning nursery rhymes, playing rhyming games, problems with coordination. You would really see the child and notice the child, for example, sitting on the floor playing with puzzles, or let's say blocks or cubes, and he tries to put the toy in one hand and then grab it in the other hand and then put it in the other hand. He's confused which hand to use when he's playing. So this is a very simple thing to notice by the mother, and she says, okay, there is a problem. Poor hand grip. At 5 years old, the child likes to play with Play-Doh, likes to color, likes to write or try writing. So you see that there is a problem when this child is handling a cup, is handling a pen, is handling a toy. And I'll show you the hand grip later. Okay, so I just divided the problems very simply in these circles. So we'll start with reading. So losing a place in the text when reading, the person will say, okay, I can read. I start reading the first 2 lines and I go very, very slow after that, and then everything disappears. Moving or overlapping the text. One child said, okay, I cannot see because everything is moving. I cannot see because it is blurry. I cannot see. So of course we have to do an eye examination first and make sure that this child doesn't have a refractive error, for example. That's why people or children with dyslexia, their parents bring them to us as eye care providers or eye care practitioners because they think that the child does not see. And this is how it started with me. They came to me after I did a presentation in one of the schools thinking that, okay, she's an optometrist, she works in a hospital, let me check my child's eye. So I think ophthalmologists and us optometrists will notice that these people will come to us because they think that their children cannot see at near. Needing to reread. A child will say, okay, I need to read the line 2 or 3 times to understand what I'm reading, and then I forget what's going on. Difficulty in getting ideas on the paper, organizational problem. You'd see the child will forget his workbook, his book. He writes and tears the paper. A lot of spelling mistakes. Similar sounds, especially in Arabic. As I said, our letters are all similar. If the child had a hearing problem when he is younger, he might not have learned the pronunciation of the letters properly, especially in Arabic. يعني الضاء زي الضاء زي الذاء. So it's very difficult, subhanallah. Very challenging صراحة. Difficulty hearing sounds, can't remember what words look like. With listening, so problems note taking, finding background distract, any noise distracting, and this is also patients who have ADHD and ADD. Motor control, coordination, cannot catch a ball, cannot play football, poor hand grip, cannot ride a bicycle, cannot jump a rope, cannot go down the stairs properly unless falling down. This is difficulty copying from the blackboard. Memory, dates, alphabet, times, phone numbers, right and left. And I notice them when they sit in my clinic. Where's your right, where's your left? They don't know. So when I do the E-chart, it's very confusing for them and they really get frustrated. And the child is يعني, a little bit old. He's like 12 or 13. Spatial temporal, this is again difficulty telling the time. If the mom, let's say, go and ask the child, go and get me a glass of water and call your brother, for example, he goes, you know, after 1 minute he goes, what did you say? I forgot what you said. He loses things easily. So these are basically very simple examples of all the difficulties and the dyslexic signs. Symptoms. And these are the most heartbreaking things I can really hear, or I do really hear every day in my clinic. They are very heartbreaking when you see the child saying this to me and doesn't know why and doesn't understand what's going on in his brain. So the child would say, why is reading, spelling, and writing so hard? Am I not clever? Why am I less smart than my brothers and sisters and friends? I don't want to go to school today. The teacher yells at me. Oh, I've had so many fights with teachers who yells at children at school. I wrote a lot of letters to them. I've called them personally. I visited schools personally to talk to these teachers. And no, please, these children have problems. Do not embarrass them. Do not shout at them. Do not yell at them. The child would say, reading gives me headache. I get so tired. I hate to read. The words moving. I get tired. My eyes get tired. I get sleepy. When I'm reading, everything is floating, moving, dancing. And I'll show you examples. So this is what a patient sees, actually. A dyslexic child would see this. Things are moving, dancing, blurry, not clear. Tracking problems. So one child came to me and I keep repeating this incident or this case over and over again whenever I talk about dyslexia and Arabic and English and everything, that this child was telling me that the letters were dancing and he was trying and running away, dancing and running away, and he was trying to catch these letters and these words when he was reading. And when I put the lenses on, he screamed to his mom and he said, oh mom, خلاص, letters are not moving anymore. And I was about to cry in the clinic, to be honest. Moving letters. A lot of kids, they say, okay, things are dancing or moving and I cannot really track them when I read. So this is how it looks like. Imagine sitting down and trying to read this. It's very frustrating. Floaters. I can see floaters. طبعا floaters, okay, it's another condition. I mean, adults, they can have floaters because of retinal problems, myopia, whatever it is, but no, the children, they shouldn't have floaters, or it's very rare for them to notice, but the floaters for reading or dyslexic signs are different. So as you can see, spaces between letters. So they say, okay, I read 1 line, 2 lines, and then everything disappears, and then one word appears, and the other word appears in the other line. So what is this? I cannot understand. Seesaw, dancing. White spots. I also had an incident of a child telling me that I always feel that the book is dirty. I always try to clean my book. Okay, what do you mean? Do you spill anything on it? He says, no, I feel that it is dirty. There's like Clorox on my book. It is not clear. I always have a tissue with me to clean it. He thinks that his book is dirty, and this is what we call white spots on letters. Okay, so that was examples of visual dyslexia. Now we have the dysgraphia. So dysgraphia is a part of dyslexia where the person has writing problems. He writes upside down, as you can see here in the yellow picture. Spelling mistakes. He goes out of the line. Sometimes he writes one word small, the other one is big, one word on the line, the other words are not on the line. And as you can see, this one is an example of one of my cases. He is 12 years old, and this is how he was writing in school. And by the way, this one is called mirror imaging. So I could not read what is this, but then when the child puts it in front of a mirror, he can read. And I had a smart girl, mashallah, صراحة. She is amazing. She has a mild visual dyslexia, very, very mild, okay? She cannot read unless she's standing in front of the mirror, holds the book in front of the mirror. And she can read very, very fast when she is in front of the mirror. When she's away from the mirror, she cannot read. But of course, after wearing the lenses, she's better. But she was amazing. I mean, it was the first time for me to see such a case. She read in front of the mirror very, very quickly. Once she sits down and put it like a normal way, she cannot read. So that was really interesting for me to see. This is also dysgraphia, an example of dysgraphia, as you can see. Okay, this is an example or examples of normal pencil grip. So when a child starts to, this is from age 1 to 7, we expect that it's okay for the child to hold the pen in a very different way. That doesn't mean that anyone who is holding the pen in a little bit strange way, or not the normal one, the normal way, is dyslexic. No. We're just saying these are some examples. So the normal pencil grip, as you can see, this is cylinder, they call it cylinder grasp. This is the age of 1 to 1.5. Here we're going to 2 to 3. Here he's starting to use the fingers together, okay, which is a modified tripod grasp, as they call it. And now this is almost normal, where like most of us, we hold the pencil or the pen this way. And this is how dyslexic, or some of them, actually hold the pencil or the pen. I've seen this case, which the person was totally normal, or is totally normal. She's a doctor. I've seen, no, this is the only one that I've seen. I don't have the picture of the other one, but this one is like, it looks like, or they put it under dyslexia or dysgraphia, but the person is totally normal. So these are some examples. Of course, when he writes, he tries to put his finger. Somebody has to read for him when he's writing. And the way he's holding the pen, you feel the child will tell you, I cannot write. It's very difficult for me, and I feel very stressful, and my hands hurt me when I'm writing. And even when you see him writing, it's like he's pressing on the page of the paper, and he's very tired when he's writing. Dyscalculia is also a form of dyslexia where the child has problems with math, transforming information, finds counting very, very difficult. But when he says it verbally, so you say, okay, 1 by 1 is 1, or whatever, 2 by 1 is 2, but then he writes it 20, struggles to understand the mathematical concepts, especially when he goes a little bit older. And everything is written, he has to solve a written equation. This is very difficult because already he has a reading problem. Okay, clinical assessment. So what should we do for these people? First of all, taking a full ocular and medical history. Okay, ocular, we know about it. Medical history, you have to ask about any psychological problems. Did he have any problems at home? Are the parents happily married? Does this child have a new baby sister or brother? I mean, it's a really long, it takes like half an hour to just take history. Any psychological shocks? That person who came to me first time, his dad had died 2 days before he came to me. Okay, it's not that he has a psychological problem and he has dyslexia, but I asked about it, and that's when he said, okay, khalas, I don't want to go to school. Okay, he just gave up. So a medical history is very important. You have to ask, okay, did he go to a psychiatrist before? Did he take any IQ tests before? Was he seen by a what do you call them in English? اللي هم الأخصائيين التربويين. sorry, I don't know what they're called in English, but هم الأخصائيين التربويين. هذه بعد مهمة لأنه they do tests before school now. So has he been seen, you know, by anyone other than an ophthalmologist or an optometrist? Of course, full ophthalmology and optometry examination. We do everything, as we all know, visual acuity, contrast sensitivity sometimes, if the patient is complaining of visual symptoms, accommodation on convergence and eye tracking. Dominant eye test, it says in the literature that we have to do the dominant eye test because when we put the lenses, we usually put it on the non-dominant eye first, and then the dominant eye. And then we do the something called Wilkens reading test. If you do not have Wilkens test, because you need to be certified to use the Wilkens, if you do not have the Wilkens reading test, you can use any test. Sometimes I just tell the patient to get me Kitab Loghati or any reading book that he's using and finding difficulty reading in. So this is not necessary. But then I'll just tell you what to do or the steps of doing the test. Observation while reading. You need to see, of course, you need to ask the mom when he reads, does he rub his eyes? Does he cry? Does he tilt his head? Do they sleep in school? Does he prefer bright light, reading in bright light or reading in dim light? Is he upset? All these, and then when you start, letting the patient sitting next to you. For me, it takes me an hour to do a dyslexic screening test for the first time because I have to build a good relationship with this person to be able to get information from the child and also to analyze what's going on. So it takes a long time, but I give him time, to be honest. So I let the patient sit next to me on a still chair, not the rocking chair, not the one that turns. It has to be a still chair. And then he starts reading. You look at his eyes when he's reading, the tracking, if it's tearing, if he's rubbing, if he's moving his head and shaking it, if his voice is low, what else? If he's shaking, if he's hesitant. This is also important. All these observation when the child is reading. And again, I asked the mother to get me, or I printed in my clinic, apart from the Wilkens, I printed some pages from, as I said, different stories and different books, so I can examine the child, because sometimes they get bored from Wilkens, so I give them interesting stories without pictures, of course. What is a Wilkens reading test? It was developed by Wilkens et al. And it is not a measure of cognitive ability. So it doesn't show us, is this patient smart or not? It just compares the effects of reading simple words with and without selective overlays. And we can again test the child starting from the age 7 and older, because at age 7, he's supposed to read simple words and simple sentences. And basically, it is they are 150 words, 15 common words in almost a line. They are single spaced. It is designed, I mean, the text is 9 size, and it is a Times font. And what we do, we are supposed to ask the patient to read these words within less than 2 minutes, okay? All of them. So the 150 words within less than 2 minutes. And then we have to record the errors that you see. Let's say, come, see, the play, look, okay? The patient read it, come, the, up. So you write down, okay, he is missing words. He is rubbing his eyes. He is tilting his head. He is scared to read. He's not confident to read. He read the word cat, tack. He read the word my, me, like this. Every single detail you have to write it to know, what is the problem? Is it visual? Is he rubbing his head? Is he doing any visual symptoms, or it's just phonological? This is a difference. Dr. Hussam Shaban, he is my mentor, my teacher. I met him in 2006 at an SOS conference, by the way. And I was the only one back then who was interested in Chromagen lenses. He presented a very short talk, 10 minutes in the conference about a case. And I remember running to him and telling him, okay, I need to learn this. So he works in the eye care clinic in Riyadh. He is not a doctor, but he is a specialized in dyslexia. He has PhD in dyslexia, and he's the one who did his PhD study on Wilkens in Arabic. So as you can see, these are words in Arabic as well. This is just part of it. And these are opposite words. So لعب, يلعب, مفتاح, تفاح, مرح, حرم, and like this, okay? So we can use the English and the Arabic together, or again, you can use any story with a normal font without pictures. This is just a study showing visual stress. So dyslexia or symptoms of dyslexia, they are similar to convergence insufficiency, accommodative insufficiency, or accommodative, spasm, Irlen syndrome, which we're going to talk about now, and dyslexia, of course, visual dyslexia. And there was a study in 2007 by Chris and Evan, just talking about each of these symptoms and showing the percentage. So the higher percentage was duplication of letters, as the person would say, okay, I can see 6 lines instead of 2 lines. I can see things moving, jumping, dancing, fading away, and etc. And of course, double vision at near is a symptom of convergence insufficiency as well. Okay, I'm going to talk briefly about Irlen syndrome. Irlen syndrome is a perceptual disorder caused by an interruption of the visual process between the eye and the brain. It is basically hyperexcitability of the visual cortex, where extra absorption of light by the retina, by the brain, or by the eye actually, يعني hyperexcitability of the cortex, and the eye absorbs more light, that then the patient will see or be uncomfortable in bright light. And I'm going to show you what I mean. It affects many areas: behavior, attention, concentration, self-esteem, and depth perception. I'll talk about a case later in one slide, but I'm just telling you the symptoms. So the symptoms a little bit different than dyslexia. The first symptom they come and say, I cannot tolerate light. Fluorescent light, bright lights, sunlight, lights at night. Okay, we don't like lights at night, especially now when we're driving, but some people really cannot tolerate lights at all and need to close all the lights where they're in the house. No fluorescent light, no white light, no bright light. Some of them, they don't even go out of the house. And I'll tell you an example right now. Some individuals experience physical symptoms. This is also another differentiation between dyslexia and Irlen. People with Irlen who have light sensitivity, or they call it scotopic sensitivity syndrome, will have physical symptoms. Please put a lot of lines under this. They will have dizziness. They're always angry. They're always anxious. They're always irritable. This is also very important. And I've seen this personally. I've seen 16 people who have Irlen syndrome. They always feel tired after reading. And this is a common symptom with dyslexia. Other experience headaches all the time, mood changes, of course, headaches. When they say headache, we have to take a full history. Do you have sinusitis? Do you have a history of migraine? Do you have a history of constant headache? Blah, blah, blah. So it's a long history when they say headaches. And they feel tired, restless, have difficulty staying focused, especially when they look at a computer and study through computers or work through computers. Because it's a white background and it is almost like kind of a fluorescent light, but it's not, but it's white background. This is an example of these things. I had an Egyptian lady back in 2016. She came to our clinic. Our neuro-ophthalmologist saw her, and I've presented this case in one of the conferences talking about this lady. Literally, she had problems. This is a rug in her house. This is her bag. This is the pattern. She cannot see patterns at all. Imagine she was sitting next to me in the clinic, and my table had like spots, white and blue and black spots. She turned her head, and I was like, why are you turning your head and looking at the window? She said, I cannot look at you because I cannot see. I don't want my eyes to go on this pattern. I feel nauseated. And she visited 7 clinics after she came to us, she was diagnosed with Irlen syndrome, severe Irlen syndrome. She was studying master's degree online. She stopped, and after giving her the lenses, she went back to normal. And after 6 months of wearing the lenses, she passed, and she finished her master's degree and sent me a message. So she didn't know what's going on. She thought she had a brain tumor. She thought she had MS. She went to exactly 7 clinics before coming to us. So put in mind, please, that the dyslexic patient is just having problems reading and understanding what is read. The patient with Irlen syndrome will have the same symptoms regarding reading, but there are other physical symptoms involved. And this is how, for them, like, it's more bright. With Irlen syndrome, the things or the screens and the books are more brighter than the regular, like than the dyslexic view, as we can say. Okay. So dyslexia versus Irlen, in a very simple way, dyslexia is a language-based disorder. It has to do with the magnocellular pathway. It has to do with the function of parts of the brain. That has to do with phonological concepts. And it is the inability to connect the letters and words that is seen on the page with their sounds and meanings. But Irlen syndrome is a perceptual processing. It has to do with the visual cortex, hyperacceptability of the visual cortex. And again, these people are sensitive to light, to specific wavelengths of light, patterns, and they have physical and visual symptoms together. I hope this is a clear, very basic, very simple identification or differentiation between both. Okay, how can we help? Optometrists, ophthalmologists, eye team. How can we help? Okay, so the intervention started in 1983 by Maris Irlen. She's the one or the founder of Irlen syndrome, or scotopic sensitivity syndrome. She used the colored overlays sheets for people who have poor reading, or they have problems or headaches when they read. And then in 1997 to 2000, there is an optician called David Harris. He is the founder of Chromagen lenses. And the Chromagen lenses are FDA approved. They are a global invention in the UK since 2000. And they are worldwide used for color blindness and dyslexia. The long wavelength, which is the pinkish colors, they are used for color blindness or for helping people with, it's not a cure, it's just helping people with color blindness. And if you want, I can do a presentation on that and show you my patients. And the light or the short wavelengths, which are the dark blue, aqua, green, and yellow, they are used in patients with dyslexia. And this is how he categorized the two different wavelengths. The history of colored filters, actually, it is not new. It started in the 1800s. Imagine, where somebody called dyslexia reading blindness, he started to use different colors. And then after years and years and years of research, their first study was in 1958, where somebody or a student started to use yellow page, and the researchers found out that he read faster. Irlen, again, was the pioneer in 1980. And she used colored overlays with much more colored wavelengths. And then now it is used as glasses. But Irlen technique is a little bit different. But I usually use Chromagen lenses with Irlen patient, and it worked. Working with dyslexia research, there was a study in 1995 who used blue and yellow lenses, both of them, and they found out that it has a good impact on the function of the magnocellular pathway between the eye and the brain, and the patients, they read faster with no errors. In the 21st century, there were colored lenses called Chromagen by, again, David Harris. who did a few or a couple of studies, and I'm going to talk about the Chromagen. So basically, they are painted colors, hypnoscopic filters, which is a good option in a treatment for patients who are struggling with reading. And who have visual dyslexia. It is non-invasive. Of course, it doesn't involve any surgery or chemicals or anything. They were okay in 1997, and then they were again, which is a very important thing. They were FDA approved in 2000, and they are, by the way, FDA approved here in Saudi Arabia by Hayat al-Dawa. That's what Dr. Hussam told me. They are approved in Saudi Arabia as well. History, the founders are Counter and Nasal in 1990, and then there was John Stein, who did a couple of researches in 2003. There is a Moroccan optometrist in the UK, whom I personally contacted in 1990. I mean, not in 1998. He first started using Chromagen lenses in 1998. I contacted him personally because I had a cousin in the UK who had dyslexia, and he's the first Arab optometrist in the UK using Chromagen lenses, and he has the colorimeter, and he has the Chromagen lenses with him, using it for dyslexic children. In Amman Arab University, they use Chromagen lenses as well in 2004, and me and Dr. Hussam started using Chromagen since 2006 up till now, alhamdulillah. Both of us are working with Chromagen for color vision and dyslexia. Okay, so visual treatment. If both they have visual problems, cannot see letters clearly, things are moving, photosensitivity, the background is very white, too bright, I cannot read. So how does it work? It just, with Irlen, it just filters the long wavelength, or the wavelength that's causing problems and irritability to the visual cortex, to the brain, and just adjusts the various lightening and the glare and the brightness. With dyslexia, there are two types of way of helping the person or the patient. First of all, it's a multi-sensory structured language approach. So we need to talk with the parents, with the child, with the teachers, with the school, and then us as eye care practitioners. Because if it's not visual, if we have a report that the patient's IQ is below than 85%, that means it's categorized in not a learning disability, it is something else, and then this is out of our hands. Chromagen lenses, they basically, what they do, they just resynchronize the information between the brain and the eye through the magnocellular pathways. And if the patient has visual dyslexia, it eliminates the visual problems, and the patient can see better, so thereby can understand what is reading. Okay. Please just know that I do not prescribe Chromagen lenses for every child in my clinic. First of all, they are very expensive. A lot of people cannot afford it. So I've missed a lot of treatments because children who had who were severely dyslexic, but I couldn't prescribe it for them because it's very expensive. So we do not prescribe Chromagen lenses until I have to test the child at least 3 times a week apart, to really make sure that these lenses and the parents are very satisfied, and they have to be with me in the clinic to see the difference of the speeding and the errors and how the child reads. And I always insist on having both parents with me, not only the mother. The father is also important to be in the clinic to see what's going on, because most of the fathers don't teach their kids or anything at home, so they don't know what's going on. So I really make sure that the child really needs, or at least I tell the parents, it will not help him unless he reads more and writes more and practice more, but it might help him, let's say 30%, because it eliminated his visual symptoms. So this is a really important point to talk about. Chromagen lenses, they come in contact lenses, soft contact lenses. This is helpful in people who have color blindness, especially male, because, you know, if you prescribe a pink or a red pair of glasses, it's very embarrassing. So the good thing, it's just, you know, soft contact lenses where the pupil is just colored and it does not look, you know, strange for them and cosmetically acceptable. It could be, of course, single vision, or it could be toric. Contact lenses are available, and we've prescribed so many, me and Dr. Hussam, especially for people who have color deficiency. I've never prescribed contact lenses for kids because, of course, they prefer using glasses. Okay, so a lot of people, I'm sure they're going to ask, how do we choose these colors? So basically, it's a subjective exam. What does it mean? Okay, I let the child read 2 or 3 lines. Again, I have to see all the physical symptoms. Physical or body language, as I call it, is very, very important. I'm just telling you what I do in my clinic. So body language is very important. Before the lenses, I see how many words did he not read? How many words were wrong? How many, you know, how many mistakes did he make? And then his physical symptoms. Was his voice low? Is he, you know, very nervous? Is he not confident? Does he rub his eye? Does he move his head? All these. And then I put the lenses on. I start with the non-dominant eye. I put, let's say, left and right, doesn't matter, left and right. I just put one color. So it's either, let's say, dark blue, dark green, and ask the patient, what do you see? Is it more comfortable? Some people will give me an immediate response, like that child. He said, oh, it stopped moving. That's it. Yes, now I can see the letters. Yes, now I can see the spaces between the words. Yes, now I don't see any white dots. These are when the visual symptoms are severe. You will see the child's reaction. He's jumping and smiling, and you know, you can really see his facial expressions. But when so it's subjective, and then you say, okay, is this color better or the other one? Is light blue better or the dark blue? And of course, after the visual symptoms are eliminated, I ask the patient to read. Some patients can read better, can read faster. And I always ask the patient, okay, let's say he read 2 lines. What did you read? What is the name of the boy in the story? What is the name of the dog in the story? Like this, okay? I have to ask him, how many words did you, like, let's say this one, ذهب هما يكفي. Okay, how many words did you read? He goes, ذهب. Some of them, they don't even remember the 6 words at all. And some of them, they remember, okay? Even without lenses, they do remember. So they have a good auditory memory as well. So it's basically subjective. You start with the dark blue and then the light blue, and then going to the yellow and green. And you see the patient's response. This is all I can say. Some patients will say, okay, oh, no, the yellow is too bright for my eyes. It hurts, please take them off. You know, you just see an immediate subjective response. And of course, again, you record the errors. So you see the errors before the lenses, after the lenses. And I always tell the parents, it is not a miracle. You need to let the child read more and more and more for a few hours, half an hour a day. You give them, I try to give them like multi-sensory what do you call them? Multi-sensory online games, multi-sensory toys. I show them pictures. I tell the parents, if he's a little bit younger, use the Play-Doh. Any multi-sensory fun activity that the child can do to help him learn more and learn better. This is kind of my last, almost before my last slide. I just want to show you or share with you this lovely family. So this one is the first person I saw with dyslexia. Mashallah, now he finished university from the US and he's getting married. So he's more confident. These are his nephews. Okay, this one, and this is his sister. She used to have severe headaches. She has MS, so we thought that the headaches is from the MS, but it's not. She always has problems when she works in the computer. She cannot stay more than 15 minutes on the screen, and they are still, since 2006, they are still with me. The sister came 2 weeks ago to renew her glasses. So they're still very happy with the glasses and they are using them all the time. So alhamdulillah, this is a successful family that I've helped. And I'm very happy to be a part of their life. At the end, I would like to thank everybody who attended today, who listened to me, and I'm ready for all these questions. I just want to talk about my achievements throughout the year. I'm very proud, alhamdulillah, with my achievement. I'm very proud and I thank Allah for my family and all the doctors and all the students and Dr. Hussam, of course, for helping me doing all these campaigns. I've visited 12 schools, King Fahd University, all the doctors, all our colleagues are very helpful. I've been in 2 TV shows. I'm always at the university campaigns, alhamdulillah. And I've done 3 Vision Day events in Jeddah, in Riyadh, and in 2 here in Sharqiya with Dr. Hussam. So alhamdulillah, we've diagnosed a lot of kids, we've helped a lot of kids, and inshallah, our role as ophthalmologists and optometrists, number 1 is teaching people, keeping people aware. Even if they know what dyslexia is, trust me, 10 years ago, people changed, mashallah. Now they are very aware, they understand what's going on. At least they come to an eye clinic and say, okay, my child has this problem. Where do I go? What do I do? So our role is trying to find places or centers. I've just tried to, grab some of them because I use them with a lot of patients and I give them to a lot of patients. So try to find a center that diagnoses dyslexia mentally, or let's say phonological dyslexia, if you did not find that the child has visual dyslexia. Learning disability أو جمعية صعوبات التعلم, they have a lot of programs. They progressed throughout the years, to be honest. We have all these centers in Riyadh and in Jeddah. You can search more and just tell the patient. So what I do is, okay, the patient comes to me, I do all the examination, and I say, before I do the dyslexic visual examination, I need you to go to this place. So for example, Markaz Shumu' al-Amal, you need to do an IQ test. You need to do other tests to tell me that, okay, this child does not have or let's say he has a learning disability, he has dyslexia, his reading skill memory is okay, his auditory memory is okay, his phonological skills are okay, but he cannot read, blah, blah, blah. You know what I mean? So first of all, after doing all this, before doing the dyslexic screening test or reading test, you need to have a report of saying, because here in the kingdom, we have صعوبات التعلم and we have بطء التعلم. I'm sorry, I can't really, it's not in my mind now to translate it in English, but عندنا صعوبات التعلم وعندنا بطء التعلم. كثير أطفال يجون إن عندهم بطء تعلم وعندهم تخلف بسيط وحاطيهم في الصف مثلا صعوبات أو دمج وكذا، وهم ما عندهم صعوبات تعلم، هم عندهم بطء تعلم. بالتالي أنا ما أقدر أساعدهم، لكن أقول لهم مثلا روحوا مركز كذا، روحوا مركز كذا. أنا دقت صراحة وشفت إنه شفت إنه عندنا مراكز تعمل الفحوصات هذه، الذكاء، القدرات، وحتى المدارس الآن قاعدين يحولون الأطفال هذول إلى صفوف دمج، إلى عندهم الحين they have like I've visited some schools here in Eastern Province. They have something called a shadow teacher, which it is not from the Ministry of Education, but the schools started having a shadow teacher, which of course at the West they have a lot, but or in the US and whatever. A shadow teacher is a teacher who sits with the child at the class and helps the child, especially reading. In reading, in their exams, reading their exam sheets and whatever. So basically, when the child, after I diagnose and I say, okay, this child is dyslexic and the child needs glasses or lenses, then I write a report to the school. And then I write the report to the school and I say, okay, this child has this. What are the recommendations? The recommendation is for the child to sit in front of the class, to have eye-to-eye contact with the teacher, to let somebody, of course, give them less time for the exam. More time for the exam. Let somebody read for them the questions during the exam. If you can make the exam not written, on the computer or whatever, please do that. So any recommendation that the parent asks me to do, maybe maybe could be helpful for the child, I write it in the report. And it's really important to give a recommendation from an eye specialist, because, you know, still the teachers who studied, you know, dyslexia and studied, you know, learning disabilities still does not know, and I've met a lot of teachers still does not know the difference between dyslexia as a subject and learning disabilities. It is totally different. Okay, it is under it's the umbrella of learning disabilities, but dyslexia, the child is totally normal. Brain function is normal, except there is a little bit of miscommunication between the brain and the eye in a phonological way. So this is what they say, and the problem is they put them in mixed classes, which really affect the you know, psychological aspect or psychology of the child. The child is very smart and everything, and then they put them in a class where, you know, other kids who have other problems, sometimes they're autistic, sometimes they have severe dyslexia. So this is also an important thing for us to mention in our report, that okay, this child is normal, vision is normal, everything is normal, except there is like this. And I also mentioned, give them a small brief about dyslexia, and then this child is going to wear these lenses in school, and these are the recommendations. And then I have to see the child in 3 weeks after wearing the lenses, or in 1 month, to see the update. And as I said, for me, I really went to schools so many times to talk to the principals and everything, of course, female schools, to make sure that this child is not abused, because the moms asked me to do that. So thank you very much for listening to me. This is my Twitter. I always put posts and new things and my experience with my patients in the Twitter. And I have my email if anybody had further questions after the time allowed. I would be happy to answer. Thank you very much.
Thank you, Dr. Zainab. Wow, it's really very interesting topic. I enjoyed your lecture very much. And I see a lot of questions in the Q&A. I have a question for you. Now, now you mentioned the Chromagen lenses. The Chromagen lenses that are used for dyslexia and they're used for the colorblind.
Yes.
I don't understand, how does it work in both things? Yani the mechanism or the pathology is so different.
Yes.
So how does it work in both?
Now, I had an issue for so long, and if Dr. Hussam is with me and listening to me, we had an issue. المشكلة, the company the company never ever explained even the literature. They just say, okay, Chromagen lens, especially with the color blindness, Chromagen lenses in dyslexia, it's, you know, basically resynchronizes the information and, you know, helps to redevelop the information between the brain and the eye, and that's it. In color deficiency, they say, okay, it reduces the or it reforms or يعني يقوم بتعديل الضوء اللي داخل العين to let the patient, or blocks, let's say, blocks the extra light or the extra light that goes into the eye and tries to sorry, the words are going. انه يساعد على تنشيط الضوء الخامل اللي ما يشوف المريض in red-green deficiency. This is how, sorry, my words are just messed up, but this is what they say. They never ever, we tried so many times to tell them, okay, is there like a good literature? The problem with Chromagen is it's a trial and error. If I tell you now, I personally used it in 4 things, and I'm going to write a paper, or I'm writing a paper now on it. I used it in even patients with Conrod dystrophy. And I'm not going to say more, but imagine, I used them in patients with Conrod dystrophy and Irlen, dyslexia, and colorblindness. And all of them, they worked. The mechanism, I cannot really tell, and it is very poor literature about it, but each one of them has a different technique of using them. And inshallah, my paper will be released soon. But the technique or the pathology is different, Dr. Amal, as you said, but unfortunately, the literature is still poor regarding this issue.
Okay, and it's a trial and error.
Yes.
So basically, you try the different filters and see which one fits the patient.
Yes, in color deficiency it's much easier لأنه it doesn't need any يعني in dyslexia maybe it's a little bit harder to use and يعني it needs شوية more time and more experience from the person. بس إنه بالcolor deficiency okay, what basically you use Ishihara and the 15 hue test. So you use Ishihara, the person cannot read, you put the lenses on and then you say can you see the numbers, and he goes yes I can see, and he passes or not passes. عرفتي? That's it. هذه بالcolor deficiency. But in dyslexia or with dyslexia يعني it needs a little bit time. Sometimes the child is severely dyslexic, or sometimes the child just has convergence deficiency, or sometimes the child just has poor vision, or sometimes يعني I've had a case in Jeddah who holds the book very close and tilts his head and you know cannot see and squeezes the eyes when see. He had a -10 in one eye and a -4 in the other eye. So that was just only refractive error when we screened him. You know what I mean? But with color deficiency, Ishihara. يعني all the literature is talking about Ishihara, that you put the lenses on, the person passes Ishihara or fails Ishihara, and it's basically with color red-green deficiency that works with يعني.
Yeah, this goes with Dr. Mohammed Shamrani's comment that we have to keep in mind that the convergence insufficiency can cause headache and difficulty in reading, and you have to be careful not to overlook that.
Exactly. Yes, that's the thing. إنه يعني it's يعني كلها نفس الشيء لأنه convergence deficiency, accommodative problems, prolonged reading times or near work. It will give you all the symptoms. Sometimes it's very confusing because the patient does not really know or understand what to tell me. You know what I mean?
Yeah. These studies that you have mentioned, the one from Kuwait and one from United Arab Emirates, I was shocked with the percentage. That's too high.
Yeah.
10% or 18%, that is very high.
Yeah, and I can assure you, Dr. Amal, that we have the same number and even more here. Trust me, we have a lot of people who are not diagnosed.
Do we have criteria for the diagnosis? Definite criteria?
Mainly it's just the reading. يعني mainly all the literature we're talking about reading. يعني reading tests. That's it. And mainly they were talking about Wilkens. So it's just a reading test and يعني noting or looking for errors while reading. That's it.
Yeah.
And all of them talk about slow reading, poor reading. That's what they say.
Then the Wilkens reading test, is it easy to get? Can you buy it online or something?
Yes, you can buy it online, but the Arabic version is not online. But the other one, the English version, is online. Yes.
Okay. Now the other thing, someone asked, does the left-handed or right-handed people, is it related to dyslexia?
I've read one article, and actually from the patients that I've seen a lot of children, or most of the children that I diagnosed were left-handed. And I remember, wallahi, I was digging through all my lectures. I couldn't find the lecture. The paper. I didn't know where I read it. I read one paper talking about they were left-handed. But it was a long time ago, and it's not necessary. A lot of other kids, they are also right-handed. They have dyslexia. It does not show if it's more in females or male here. So the prevalence is about the same. It's not. There's no difference.
I think I read in one of the reference it's more in male, in boys. But I could
maybe. And I haven't صراحة noticed if it's more in boys and girls. But I have both.
Now, someone asked, do you get adult type of a dyslexia, or is it it's a kid's disease?
It's a kid's disease. You are born with dyslexia.
A normal child, and suddenly as an adult reading difficulties.
يعني if you see my interview on TV, I had a 42-year-old. He was dyslexic. I had a child as well. يعني on the show, we had a child, and we had a 42-year-old who was dyslexic, but he was not diagnosed. and he was dyslexic through all his life, and he managed to finish university and study because he found out a way of reading by himself and learning by himself. He used to listen to things, and he was very he had a very strong auditory memory. So he was fortunate in being in a school who helped him to be examined and everything, يعني without writing, without answering questions, except what do you call them, يعني in auditory way. So he's dyslexic, and he's 42 until now. He's dyslexic, but thank God he has 4 children. None of them is dyslexic. So
And,
it was
my
yeah.
question is that it's not an acquired disease.
No, it's not. No.
Someone he's born with it, actually.
Yes, they're born, unless we can say if the child is born, and again there are environmental factors. If the child is born in a very let's say illiterate atmosphere, children who are suffer from the wars and everything, they did not learn, so they are illiterate, so we can say they could be dyslexic. You know what I mean? Because
yes.
they did not learn. And somebody's asking, does stress affect dyslexia? I'm not sure, but they will be very stressed because they have a problem and they don't know what it is. So it could increase. It might start very low or very mild, and then it might increase because he will be more stressed emotionally because he doesn't know what's going on.
And in the adult type, if you in the the patient you mentioned, did you use the Chromagen lenses?
Sorry, Doctora, again?
The patient you mentioned, the 42 years old, did you use the Chromagen lenses for him?
I didn't test him. It was just, we were just on the TV show. I didn't test him, to be honest. Yeah, I didn't test him. But I always tell him, you need to come back to me. But he said he was interested to be tested, but we didn't have the chance. He lives in Jeddah, and he just left immediately after the show.
Exactly. Good.
So, yeah.
Well, I think we have. Now, the other thing is someone has asked about the memory problem. You mentioned some of them might have some memory issues.
Yeah, I think it's just because, the brain, the setup of the brain itself is, different, and they're using a different part of the brain. That's why, it's just, they have some memory loss. And one study was talking about color vision, colors, identifying colors. So children who are dyslexic might not be able to identify colors. But then there was another study said that this was wrong. So I'm not really sure. And this, there is somebody was saying, it is stated by American Academy of Ophthalmology that the dyslexia isn't a visual problem, and treatment shouldn't be visual behavior. They said all the evidence are weak, and treatment by special education people. Well, I don't know about that. They should give evidence why they said that, to be honest, because it is visual, and a lot of other studies are saying that it is visual. Do you do dyslexia screening tests for adults? Yes, and it's the same as children. As I said, the most important thing is being sure that the person can read. So that's why we start from the age of 7 actually. For adults with dyslexia, Chromagen lenses are effective. Yes, I had, I think in 2010, if I'm not mistaken, there was a university teacher. He was a dentist. He came to me and he was 56 years old. He tried Chromagen, but he didn't buy it. But he tried Chromagen because he came to the clinic, and one of our doctors told him that he was telling the doctor, the ophthalmologist, that he was dyslexic, and then he referred him to me, and he was so happy to find the lenses. But I only saw him once, and he didn't come back to me. But yes, they are effective for adults as well. But again, if you grow up with dyslexia without any treatment, you adjust yourself to a specific learning criteria, and you learn by yourself or on your own, as we say.
As you mentioned, some of them, their IQ is higher than normal. Some of these children,
Doctora, they are very, very smart, and their interests are very different than others. subhanallah, they like poetry, they draw, they are very imaginative, they have a very, very large imagination. يعني I've seen so many talented children عندهم dyslexia. And if you يعني read the literature, Einstein was dyslexic, Thomas Edison was dyslexic, a lot of actors and actresses are dyslexic, so a lot of great people are dyslexic. Steve Jobs was dyslexic.
Yeah. Someone also mentioned that is it possible to find out dyslexia under age 3 years? I think you mentioned this in your lecture.
I mentioned that, no.
There are some signs that you should look for and might give you a clue. I think
3 years, no, because as I said, we need to, يعني, if we, okay, there might be some signs, but 3 years old, the only sign you would see is, or you would notice is that they're not, or late speech, يعني they're not talking yet. That's it. Or they have a hearing problem. That's the only thing. The child will not read, will not learn, you know. But this could be a sign for later. But 3 years, no, we never say.
Yeah. Dr. Mohammed Shamrai mentioned to us that there is Dr. Reem Al-Kahtani from the University Hospital that she's interested and she wants to talk. She can raise her hand. We can let her in. But in the meantime, I don't see her hand raised. I don't know if she's still with us or no.
السلام عليكم.
عليكم السلام. تفضلي دكتورة.
أهلا. Thank you, Dr. Zainab, for this lecture. I would like to add a new information resulted from my study in 2015. It was a comparison between the Arabic letter اللي هو arm lengthening method and the Chromagen lenses in improving the reading performance in اللي هو dyslexic children. We know that the main problem in dyslexia is the letters or words crowding. We can easily reduce this crowding by some اللي هو modifications in the letter أو يعني أو words such as extra large letters spacing اللي هو باللغة الإنجليزية أو اللي هو Arabic letter arm lengthening. So we can allow a child with dyslexia to read more words in a less time. So if we apply some modifications to the words, it will be, I think, cheaper than the Chromagen and also cosmetically more acceptable. Thank you very much.
Thank you, Dr. Can I answer or talk about this? We've tried, a lot of schools, they've tried modifying, and a lot of parents trying to modify or do what you said, and they make the letters bigger, the words a bit bigger. It's still a problem. If they have visual dyslexia, Chromagen lenses are the most helpful method. And some of the teachers, they are really good in school. They make the books bigger, the text bigger. Sometimes they print on yellow pages, sometimes they print on pink pages. And يعني في اجتهاد كثير. لكن لاحظنا خاصة من الأهل يعني والمدرسات. لكن أنا لاحظت إنه فعلا ما يعني الكروماجين lenses is the best solution if the child had visual dyslexia.
ايوه هو دكتوره زينب انا قارنت بين اللي هو الكروماجين لينسز مع اللي هو طبعا هذه تعتبر نيو ميثود اللي هي يعني انا سميتها اللي هو الارم لينثنينج يعني مثلا اللي هو اسم مثلا ريم ما يكتب بشكل عادي اقوم انا يعني اسوي زي اللينثنينج للحرف الياء فيصير عندي زي السبيسنج سو اي
طب هذه for how long يعني for how long ومن اي عمر تبدأيها؟ معناها الطفل حيكون شايف هذه الكلمة forever كذا شكلها عرفتي
طبعا أنا سويتها اللي هو المرحلة الابتدائية يعني على 30 ديسلكسيك
كم أعمارهم؟
تشايلد كانت من أعمار اللي هو 9 إلى 12 بالحرس
9 إلى 12 دكتورة 9 إلى 12 already عارفين شكل الكلمة الصحيحة يعني بس when you start at an early age من أولى ابتدائي مثلا أو خلينا نقول ثاني ابتدائي إحنا نشخص ديسلكسيا الطفل إذا قرأ الكلمة هذه بهذا الشكل for a long time راح يظن إنه هي كذا شكلها وهي مو كذا شكلها. فهمتي قصدي؟ عرفتي؟
نعم نعم.
from 9 years old is good لأن هو already شاف إنه الكلمات لاصقة في بعض، الكلمات سبيس طبيعي. الطبيعي إنه يكون سبيس كذا شكلها مرتبة. لكن إذا تورين هذه الكلمة أو هذه الطريقة أو هذه الميثود، الطفل تو قاعد يتعلم أولى أو ثاني ابتدائي، ما راح يتعلم بالطريقة الصحيحة، راح يتعلمها إنه الكلمات كذا شكلها مفرقة بهذه الطريقة، حتى لما يجي يكتبها راح يكتبها بهذه الطريقة. عرفتي المبدأ؟ This is my opinion. ما أدري صراحة، أنا ما جربت بس قاعد أقول لك يعني ككونسبت يعني.
I think يعني احنا يعني ممكن
بس
نسوي
يعطيك
يعني
العافية إذا you can يعني you can pass me the study حتى أقرأها. I'm interested صراحة إني أقرأ الميثود هذه. و if you want to try it كمان على kids اللي هم أصغر. بس أنا زي ما قلت لك الحين بس كذا في بالي إنه قاعدة أفكر إنه يعني they might learn in the wrong، مو the wrong way، بس قصدي in a different way، بحيث إنه يعني يتعلمون إنه دائما الأشياء كبيرة، بحيث حتى لما يجون يكتبون everything spaced out. You know what I mean؟ هذه بس خوفك من النقطة يعني. فحلو إذا مثلا تعقبين تسوين another study على children شوية أصغر يمكن to see هل هم فعلا يستوعبون هذا الشيء، وهل فعلا يتأثر عليهم مثلا يعني المراحل الجاية ولا لا.
دكتورة if I may talk إنه the problem with the Chromagen lenses had it's really very expensive.
Yes دكتورة، بس a lot of people can't afford it. مش يعني it is affordable for some people، واللي ما يقدر يسويها يقدر يسوي أشياء اللي هي تربوية، يقدر يروح يعني يحطوهم في مراحل اللي هم صفوف الدمج. عرفتك يعني there is في تدخل بصري وفي تدخل تربوي، والتربوي 70% أكثر من البصري. يعني دائما أقول لهم البصري 30% ترى، مش أكثر، 30 ماكس 40-50% بعض الدراسات. لكن التربوي هو الحل. التربوي إنه التيتشر درس بطريقة مختلفة using multi-sensory techniques. التربوي كثير أكثر من عندنا كتريتمنت أو كحل.
إنه these children can be really if they are under stress يعني their symptoms becomes worse.
ما هي مش يعني هي يعتمد كمان على تقبل الأهل، تقبل المدرسة. أكيد راح تشوفين a lot of kids عندهم psychological problem ولا يكونون تعبان نفسيا، لأنه مو بس dyslexia other things that تواجه الطفل والأهل مثلا ما يعرفوها أو ما يعرفون يروحون أو يعني هذه هي النقطة. بس أنا صراحة اللي شوية مثل ما يقولون مفرحني إنه الأهل are more aware. يعني صاروا مثلا يقرون، يعرفون مثلا وين يودون أولادهم، أو مثلا يعني زي ما يقولون أسوأ أو يعني مش أسوأ، مثل ما يقولون يعني أبسط حل أوكي أروح أوديه دكتور عيون عشان أشوف هل يشوف ولا لا. يعني بدأوا شوية الناس ويقرأوا إنه يحطوا مثلا symptoms. ابني ما يعرف يقرأ كويس، كثير أهل يقولوا لي ترى أنا أحس ابني عنده dyslexia كذا يعني. فالناس شوية صاروا aware، بس إحنا أحس بعد يبينا awareness especially مثلا بالمراكز الخاصة بال private clinics. بالأحس كل عيادة تحتاج إنه شوية more awareness about dyslexia. ما أدري أنتوا إيش رأيكم دكاترة، بس I think
I agree. Yeah. But what's the youngest age you have used the Chromagen lens you recommend? The lens, the contact lens. The youngest.
مو contact lenses. أنا صراحة contact lenses ولا هي نفسها الكروماجين؟
Chromagen lenses. Chromagen they come. You can have it either in the glasses.
Yes.
As lenses أو as contact lenses, right?
أيوة الكونتاكت لينسز دكتورة أنا ما استخدمها للأطفال لأنه يعني أخاف، بس عرفتي موضوع الهايجين وموضوع بس هذه هي النقطة.
What's the youngest age يعني above 15 or something for the actual lenses؟
يعني هذه طبعا رأي الكونتاكت لينس سبيشالست زي ما يقولون أو الكونتاكت لينس optometrist. بس أنا مثلا بالنسبة لي I tell them مثلا على عمر 12-13 شوية يكون يعني الطفل شوية فاهم وهذا. بس مثل ما قلت لك ولا مرة جاتني حالة إنه يبغون كونتاكت لينسز أطفال. يعني دائما عادي النظارة بالنسبة لهم، except اللي عندهم الكونتاكت لينسز هم الأدلتس اللي عندهم color deficiency فقط. بس يعني I think ما أدري إذا في optometrist هنا أو يعني everybody agrees إنه I think عمر 13 يمكن أو 12-13 إنه they can handle contact lenses. maybe I think
around 14 usually.
yeah 13 14 is good على أساس إنه وفي ترى 12 they're very mature. بس أنا ما أفضل دائما حتى الكوزمتيكلي صراحة دائما أحاول أبعد أقول لهم لا خلوها 14 15 شوية لما تكبروا عرفتي. It's just the handling of lenses itself. بعدين هذه one pair هذه very expensive سعرها يعني very expensive. so هقول لهم حتى النظارة يعني دائما يكونون معاها مثلا زي الخيط. المدرسة لازم تعرف إن هم لابسين اللينسز هذه أو النظارة هذه عشان مدرس أو مدرسة يكونون واعين ويذكرون الطفل البس هذا يذكرون الطفل وين اللينسز لأنه يضيعها الطفل يعني. ففي كذا specifications دائما أقول لهم إياه إنه اشتروا معها حبل اشتروا معها بوكس نبهوا المعلم أو المعلم عشان دائما يذكر الطفل وين نظارتك الزرقاء you know what I mean عشان أحفزه يلبسها يعني.
في كان كمان question for us for pediatric ophthalmologists.
أيوة.
What's the recommendation that you give us for diagnosis and management of these patients regarding to the diagnosis of dyslexia? يعني how can a pediatric ophthalmologist be helpful in diagnosing dyslexia patients?
هو أكيد helpful لأنه هو بالأخير يعني سواء optometrist أو eye care يعني professional أو provider اللي هم يعني ophthalmologist إحنا كلنا as a team إنه ما أنت حتفحصي عينه دكتورة حتفحصي عينه حتفحصي الconvergence حتفحصي تسوي له سايكلو تقدري بالعيادة تسوي له مثلا الريدنج تيست وبعدها تقولي له أوكي إذا أنت you're interested in dyslexia تدورين مثلا مركز تقولي أوكي أنا أحس يمكن ابنك عنده كذا إيش رأيك نروح نسوي له فحص ذكاء فحص قدرات حيقول لك أوكي أنا ابني ذكي أقول له معلش بس في فحص خاص إنه يورينا ليش ابنك قاعد عنده بطء قراءة أو صعوبة في القراءة أو مشكلة في القراءة غير العين يعني العين ما فيها مشكلة أقول العين ما فيها مشكلة. So it's just guiding the people in where to go and يعني وطبعا فحص العين بالكامل I think awareness that's it I think كلنا نفس يعني كلنا on the same track كأخصائي بصريات أو كدكتور عيون.
Well, I think we have answered most of the questions and I really thank you Dr. Zainab. It was really very interesting topic. I enjoyed the lecture and enjoyed every minute of it and your demonstrations and your slides were very informative. I think if except for your last slide, I couldn't read it. I know it's thank you the other way around. It's upside down. So
yeah.
is it not?
It is upside down. لا don't worry. أنا متعمدة أنا أحطها. It's not شو اسمه. It's متعمدة أحطها لأن هي dyslexic. عرفتي؟
Thank you very much, and we
You're
really
welcome, دكتورة.
interaction with the